Someone call the surgeon. This patient is critical. But Kiana Perry, the quiet night nurse who everyone said couldn't stitch a pillowcase, stepped forward instead. The medical team tried to stop her. Nurses don't perform surgery. Step aside, she said calmly, her hands already moving with precision that made seasoned doctors freeze. They had no idea the woman they mocked every shift had once performed field surgery on a Marine sniper while under mortar fire in Fallujah, then grabbed her rifle and eliminated an entire insurgent squad. From which city in the world are you watching this video today? If stories of hidden courage and unexpected heroes intrigue you, subscribe to Quiet Tales Studio for more untold tales of extraordinary people disguised as ordinary workers.
Metropolitan General Hospital's trauma bay never slept, but it hit a different rhythm during the graveyard shift. At 2:30 a.m., the fluorescent lights hummed over mostly empty corridors, casting harsh shadows on tired faces and worn linoleum. The emergency room maintained its constant state of controlled chaos, but with fewer doctors, less staff, and the kind of cases that couldn't wait for morning. Kiana Perry had worked the night shift for 3 years, and in that time, she'd become invisible in the way that only night shift workers could manage. At 34, she moved through the hospital with quiet efficiency, her dark hair always pulled back in a practical ponytail, her scrubs perpetually wrinkled from long hours. She spoke when necessary, smiled when appropriate, and handled her assignments without complaint or fanfare. The day shift doctors barely knew her name. The residents called her the Quiet One. The other nurses had long since stopped trying to include her in their break room conversations about weekend plans and family drama. Kiana Perry was competent, reliable, and utterly forgettable, exactly the way she preferred it. Dr. Johnny Andrade, the chief resident, was finishing his third double shift in a week when he passed Kiana in the supply closet. She was restocking suture materials with the methodical precision she brought to every task. "Perry," he said, not bothering to look up from his tablet, "make sure you get the inventory done before morning shift." The day nurses are always complaining about shortages. Kiana nodded without comment, continuing her count of surgical supplies. She'd heard this conversation dozens of times. The subtle implication that night shift was somehow less capable, less important than the prestigious day rotation. "And try not to mess up the IV insertion on the patient in bed 7, Andrade added casually. "I know basic procedures can be challenging for some of the night staff." This was Dr. Andrade's favorite pastime, casual condescension disguised as helpful advice. Last week, he'd suggested she practice her suturing technique after watching her close a minor laceration. The week before, he'd questioned whether she understood proper dosage calculations for pain medication. Kiana had learned to respond with silence. In 3 years, she'd never contradicted him, never defended herself, never given any indication that his comments affected her in the slightest. "Of course, doctor," she replied quietly, her voice carrying the same neutral tone she used for everything. Nurse Luciana Kelly, a 20-year veteran who ran the night shift with iron efficiency, overheard the exchange from the doorway. After Andrade walked away, she approached Kiana with the expression of someone who'd witnessed this scene too many times. "You know, Kiana, you don't have to take his crap. You're one of the most competent nurses on this floor." Kiana finished her inventory count before responding. "It's not worth the drama. I'm here to do my job." "Your job includes standing up for yourself." Andrade wouldn't talk to the day shift nurses like that. The day shift nurses went to prestigious nursing schools and have connections in the medical community. Kiana replied matter-of-factly. "I went to community college and work nights because it's what was available. Different expectations." Luciana studied Kiana's face, noting the resignation that had settled there like armor. In 3 years, she'd never seen Kiana lose her temper, never seen her show frustration or ambition or even particular interest in advancement. She was competent, professional, and utterly content to remain invisible. "You're better than you give yourself credit for," Luciana said finally. Kiana smiled, a brief, practiced expression that didn't reach her eyes. "I know my limitations." At 3:15 a.m., The trauma bay erupted into controlled chaos as paramedics wheeled in a motorcycle accident victim. The patient, a young man in his 20s, had been found unconscious beside his destroyed bike on Highway 85. Multiple fractures, possible internal bleeding, and a head injury that had the paramedics concerned. Dr. Andrade took charge immediately, his earlier fatigue replaced by the focused energy that trauma cases demanded. He barked orders while examining the patient, coordinating with the trauma team that materialized around the gurney. "I need X-rays, full blood panel, and get me an OR consult," he commanded. "This kid's in bad shape." Kiana worked peripherally to the main trauma team, handling the administrative details that kept emergency medicine functioning. She updated charts, coordinated with lab technicians, and managed the constant flow of information that trauma cases generated. From her position near the monitors, she observed the patient's vital signs with the systematic attention she brought to every case. Heart rate elevated but stable. Blood pressure concerning but not critical. Oxygen saturation adequate with assistance. But something else caught her attention. Something the trauma team, focused on the obvious injuries, hadn't noticed yet. The patient's breathing pattern was slightly irregular, his chest rising unevenly despite the ventilator assistance. His left pupil was responding normally to light, but his right showed subtle signs of increased intracranial pressure that the initial assessment had missed. Kiana moved closer to the patient, her trained eye cataloging details that experience had taught her to recognize. The slight swelling behind his right ear. The barely perceptible asymmetry in his facial expression. The way his left hand showed minor tremors that suggested neurological involvement beyond the obvious head trauma. "Doctor," she said quietly, approaching Dr. Andrade during a brief lull in activity. "Not now, Perry. Can't you see we're busy? I think you should check his intracranial pressure again." "There are signs that—" "Perry," Andrade interrupted, his voice carrying the sharp edge of someone whose authority had been questioned at an inconvenient moment. "I don't need nursing suggestions on trauma assessment. Please focus on what you're trained for." Kiana stepped back without argument, but her eyes remained fixed on the patient's monitors. She'd seen this before, the subtle signs that preceded rapid neurological deterioration. The barely perceptible changes that could mean the difference between recovery and permanent brain damage. 15 minutes later, the patient's condition crashed exactly as she had predicted. "Sir," called Kyrie Edwards, the OR coordinator, "Dr. Castaneda is deep in a craniotomy. Dr. Herschel Dela Cruz is our next option, but he's at least an hour out." The patient's monitors began screaming as his vital signs deteriorated rapidly. His pupils were becoming unresponsive, his breathing increasingly labored despite ventilator support. "We're losing him," Cooper said grimly, watching the readouts with growing desperation. "Without immediate intervention, he's going to suffer irreversible brain damage." That's when Kiana Perry did something that no one expected. She stepped forward. "I can do it," she said quietly, her voice cutting through the controlled chaos with absolute certainty. The trauma bay fell silent, except for the urgent beeping of monitors. Every eye turned to the night shift nurse, who had just volunteered to perform emergency neurosurgery. Dr. Andrade stared at her in disbelief. "Perry, this isn't the time for jokes. We need—" "I'm not joking," Kiana interrupted, her tone carrying an authority that none of them had ever heard before. "That patient has a subdural hematoma with rapid expansion. He needs immediate cranial decompression, and he needs it now." "You're a nurse," Cooper protested. "You can't possibly—" "I can," Kiana said simply, moving toward the surgical prep area with fluid confidence. "And if you want him to live, you'll let me." For a moment, the medical team stood frozen in confusion and disbelief. The idea of a night shift nurse performing emergency brain surgery was so far beyond protocol that none of them knew how to respond. But the patient's declining condition made the decision for them. His blood pressure was dropping, his oxygen saturation falling, and the monitors showed the unmistakable signs of brain death approaching. "This is insane," Andrade muttered, but he stepped aside as Kiana moved to the surgical sink. What happened next would be discussed in hushed tones throughout Metropolitan General for years to come. Kiana Perry scrubbed in with the methodical precision of someone who had performed this routine thousands of times. Her movements were economical, practiced, carrying none of the hesitation one might expect from someone about to attempt surgery far beyond her supposed training. "I need a burr hole kit, craniotomy instruments, and someone to monitor vitals," she said calmly, her voice taking on the clipped authority of a seasoned surgeon. "Cooper, can you assist?" The neurology resident nodded numbly, still processing what he was witnessing. Around them, the trauma team moved to comply with her requests, their professional training overriding their confusion. As Kiana positioned herself over the patient, something fundamental shifted in her bearing. The quiet, unassuming night nurse disappeared, replaced by someone whose confidence and expertise were undeniable. Her hands moved with surgical precision as she located the optimal site for the burr hole, her technique flawless. "10 blade," she said, extending her hand without looking away from the patient. The scalpel was placed in her palm, and she made the initial incision with the steady hand of someone who had performed this procedure under far worse conditions than a sterile trauma bay. "Jesus," whispered Edwards from his position near the monitors. "Look at her technique." Kiana worked with focused intensity, each movement deliberate and economical. She created the burr hole with textbook precision, relieved the pressure on the patient's brain, and monitored his response with the systematic attention of a master surgeon. "Vitals are stabilizing," Cooper reported, his voice filled with awe. "ICP is dropping, blood pressure improving." Within 20 minutes, the patient's condition had dramatically improved. His pupils were responding to light, his breathing had strengthened, and the monitors showed clear signs of neurological recovery. Kiana stepped back from the table, removed her gloves, and suddenly looked like a regular night shift nurse again, except for the way everyone in the room was staring at her. "He'll need proper neurosurgical follow-up," she said matter-of-factly, "but the immediate crisis is resolved." Dr. Andrade, who had watched the entire procedure in stunned silence, finally found his voice. "Perry, where did you learn to do that?" Kiana met his eyes for a moment, and something in her expression suggested depths that none of them had ever suspected. "I used to do a different kind of work," she said simply. The next few hours passed in a blur of paperwork, consultations, and barely concealed whispers throughout the hospital. Word spread quickly about the night shift nurse who had performed emergency brain surgery and done it flawlessly. Dr. Castaneda arrived to check on the patient and review the procedure. After examining the surgical site and reading the notes, he pulled Dr. Andrade aside. "Who performed this craniotomy?" he asked. "That's complicated," Andrade replied. "It was one of our nurses, Kiana Perry." Castaneda raised an eyebrow. "A nurse performed this? The technique is textbook perfect. Better than perfect, actually. This is the work of someone with extensive neurosurgical training. That's what we're all trying to figure out." Meanwhile, Kiana had returned to her regular duties as if nothing extraordinary had happened. She updated patient charts, administered medications, and handled the routine tasks that filled her nights, acting for all the world like someone who hadn't just saved a life with skills she wasn't supposed to possess. Luciana Kelly found her in the supply room, restocking surgical materials with the same methodical precision she brought to everything. "Kiana," she said carefully, "we need to talk." "About what?" "About how a night shift nurse with a community college degree just performed neurosurgery that impressed the chief of surgery." Kiana continued her inventory without looking up. "The patient needed help. I helped him." "That's not an answer, and you know it. What aren't you telling us?" For a long moment, Kiana was silent. Then she set down her clipboard and turned to face Luciana directly. "Some things are better left in the past," she said quietly. "Not when they involve life and death. Not when they involve skills like what I just witnessed." Luciana stepped closer. "Kiana, I've been a nurse for 20 years. I've seen talented people, I've seen gifted surgeons, but what you did tonight, that was something else entirely." Kiana studied the older woman's face, weighing something internal. Finally, she spoke. "I wasn't always a night shift nurse. What were you?" "Someone who learned to save lives under conditions that make a trauma bay look like a peaceful afternoon." Before Luciana could ask more questions, the trauma bay alarm sounded again. Another ambulance, another emergency, another chance for Kiana Perry to disappear back into the routine invisibility that had protected her secrets for 3 years. But something had changed. The questions had begun, and once they started, they would be impossible to stop. 3 days later, Dr. Andrade sat in his office reviewing incident reports when he noticed something odd about Kiana Perry's employment file. Her nursing school records were complete and legitimate, but they only went back 5 years. Before that, there was a gap. A 7-year period with no employment history, no education records, no explanation for what she'd been doing. Curious, he made some calls. What he discovered made him question everything he thought he knew about the quiet woman who worked his night shifts. Kiana Perry had indeed attended community college nursing school, but she'd graduated with the highest grades in her class despite being older than most students. Her instructors remembered her as exceptionally skilled, particularly in trauma care and surgical assistance. Several noted that she seemed to have prior medical knowledge that went beyond what they were teaching. But the real revelation came when Andrade contacted the VA hospital where Kiana had listed previous volunteer work. "Oh, Kiana," said Dr. Leonard Rodriguez, the former chief of emergency medicine. "Brilliant woman, absolutely brilliant. I always wondered why someone with her skills was working as a volunteer instead of practicing professionally." "What do you mean?" "Her trauma assessment skills were extraordinary. She could diagnose conditions that residents missed. And her surgical knowledge." Rodriguez paused. "I always suspected she had formal medical training, but she never talked about her background." That evening, Andrade waited for Kiana to arrive for her shift. He found her in the break room, reviewing patient files with her usual quiet concentration. "Perry, can I speak with you for a moment?" She looked up calmly. "Of course, doctor. I've been doing some research about your background." "Have you?" "There's a 7-year gap in your employment history. Before nursing school, there's nothing. No job records, no education, no explanation for what you were doing." Kiana set down her files and studied his face. "And what do you think that means?" "I think it means you were doing something you can't or won't talk about. Something that gave you medical skills far beyond what any community college nursing program could provide." She was quiet for a long moment, weighing her response. "Dr. Andrade, some people have lives they prefer not to discuss. I'm one of those people. The patient you saved 3 nights ago, that wasn't beginner's luck. That was the work of someone with extensive surgical training and field experience. Where did you learn to operate under pressure like that?" Kiana stood and walked to the window, looking out at the city lights that stretched to the horizon. When she spoke, her voice carried a weight that hadn't been there before. "I learned in places where making mistakes meant people died. Where there were no backup surgeons, no perfect conditions, no second chances." She turned back to face him. "I learned because I had to. Military. Among other things. Combat medic? Among other things." Andrade studied her face, noting the way her expression had shifted, becoming more guarded, but also somehow more substantial, as if she'd allowed a mask to slip just slightly. "Why aren't you practicing as a doctor with skills like yours?" "Because being a night shift nurse suits me. It's quiet, predictable, and it lets me help people without having to explain where I learned what I know. And what you know is considerable." "What I know," Kiana said carefully, "is how to keep people alive under difficult circumstances. Everything else is just background noise." A week later, the hospital's routine was shattered when a bus accident brought in 12 critical patients simultaneously. The day shift was overwhelmed, all surgeons were occupied, and the trauma bay descended into controlled chaos as medical staff struggled to triage the worst injuries. Among the victims was a young soldier home on leave, his injuries eerily similar to those Kiana had seen in very different circumstances years earlier. Massive blood loss, multiple fractures, and internal injuries that required immediate surgical intervention. Dr. Jonas Flores, the hospital's chief of surgery, was deep in another emergency when the soldier arrived. The available residents looked at the case and determined that the injuries were beyond their capability. The patient needed a trauma surgeon, and none were available. That's when Kiana Perry stepped forward for the second time. "I can handle this," she said quietly. This time, no one argued. They'd all heard about the miraculous brain surgery she'd performed, and with no other options available, they were willing to trust the mysterious night nurse, who seemed to know far more than she should. What followed was a display of surgical skill that left the entire trauma team speechless. Kiana operated for 4 hours, repairing damage that should have been beyond the capability of anyone without extensive surgical training. She worked with the focused intensity of someone who had performed similar procedures under far worse conditions, her hands steady, her decisions swift and accurate. But it wasn't just her surgical skill that impressed the watching staff. It was the way she handled the pressure, the calm authority with which she directed the team, and the military precision of her movements that suggested this wasn't her first time operating on a wounded soldier. When the surgery was complete and the patient was stable, Dr. Flores arrived to check on the outcome. After reviewing what had been done, he pulled Kiana aside. "Dr. Perry," he said using a title that no one had ever applied to her before, "I think we need to have a conversation." "I'm not a doctor," she replied automatically. "Maybe not officially, but what you just did was the work of someone with extensive surgical training and considerable field experience. I've been practicing for 20 years, and I'm not sure I could have handled that case as well as you did." Kiana was quiet for a moment, then made a decision that would change everything. "My name is Kiana Perry. I served 8 years as a Navy combat medic with specialized surgical training. I operated in field conditions throughout Iraq and Afghanistan, performing trauma surgery under fire with limited supplies and no backup." She paused. "I've saved lives in situations that would give civilian surgeons nightmares. Why aren't you practicing as a surgeon?" "Because when I came home, I discovered that military field experience doesn't easily translate to civilian credentials. The medical establishment wasn't interested in recognizing skills learned in combat zones. So I went to nursing school, took a quiet job, and tried to build a normal life." Dr. Flores studied her face, seeing past the quiet exterior to the competent professional underneath. "What would it take to get you credentialed properly? To recognize your skills officially? Are you offering?" "I'm saying that this hospital needs surgeons like you, and patients deserve to benefit from your experience." 6 months later, Dr. Kiana Perry stood in the same trauma bay where she'd once been dismissed as an incompetent night nurse. But now she wore surgical scrubs instead of regular nursing uniforms, and the staff looked to her with the respect due to someone whose skills had been tested and proven. The hospital had worked with her to translate her military experience into civilian credentials, recognizing her extensive field training and surgical experience. She'd completed the necessary certifications and examinations, proving what everyone already knew, that she was one of the most skilled trauma surgeons they'd ever seen. Dr. Andrade, now working as her resident, assisted in surgery with the humility of someone who'd learned not to judge people by their appearances or backgrounds. "Dr. Perry," he said as they completed another successful trauma case, "I owe you an apology." "For what?" "For 3 years of condescending comments and assumptions about your capabilities." Kiana smiled, a genuine expression that her colleagues had learned to value. "You treated me based on what you could see. Most people do. But you never corrected me. You never defended yourself. I didn't need to. I knew what I was capable of, and I knew that when the right moment came, I'd have the chance to prove it." As they left the OR, Kiana reflected on the strange journey that had brought her from combat zones to community college, to night shifts to recognition as one of the hospital's most skilled surgeons. She'd learned that sometimes the most important battles were fought not with weapons, but with patience, persistence, and the quiet confidence that comes from knowing your own worth, even when others can't see it. The woman who had once been dismissed as unable to stitch a pillowcase had become the surgeon that other surgeons called when they needed help with their most difficult cases. And late at night, when the hospital was quiet and she was alone with her thoughts, Kiana Perry sometimes remembered the lessons she'd learned in places far from civilian trauma bays. That the most effective warriors were often the ones who looked least like warriors, and that the greatest strength sometimes came from being underestimated. 2 years later, Dr. Kiana Perry had become a legend at Metropolitan General. Young residents sought her mentorship, difficult cases were assigned to her expertise, and her patient survival rates were among the highest in the state. But she never forgot the lessons of her journey about the danger of assumptions, the value of quiet competence, and the importance of giving people chances to prove themselves regardless of how they might appear on the surface. In her office, alongside her medical diplomas and surgical certifications, she kept a small photograph from her military service, a reminder of where she'd learned that the most important battles are often fought by people whose courage is invisible to those who don't know how to look for it. The night shift nurse had become Dr. Perry, but the warrior's heart that had carried her through combat zones still beat beneath her surgical scrubs, reminding her daily that strength comes in many forms and heroes don't always look like what we expect them to. Sometimes the most capable people are the ones we notice least. They walk among us with skills forged in experiences we can't imagine, carrying knowledge earned through trials that would break others. This story reminds us that extraordinary people often choose ordinary jobs, not because they lack ambition, but because they understand that true service doesn't require recognition. It only requires the willingness to step forward when others step back. At Quiet Tales Studio, we believe the most powerful stories are about hidden heroes, whose greatest strength lies not in seeking glory, but in being ready when glory seeks them. Subscribe for more tales of extraordinary people disguised as ordinary workers, and the moments when their true nature is finally revealed.